Your kidneys are failing quietly. And the most frightening thing about that sentence is not its drama, it is its accuracy. Because kidney disease, in its early and most treatable stages, produces almost no symptoms at all. It does not hurt. It does not send a sharp pain that tells you something is wrong. It does not announce itself in any way that breaks through the ordinary noise of daily life. It builds silently over months and years, while standard blood tests miss it entirely. And by the time most people find out something is wrong, a significant and irreversible amount of damage has already accumulated. There are over 850 million people worldwide living with some form of kidney disease right now. That number comes from a 2023 report published in Nature Reviews Nephrology, and it places chronic kidney disease among the most prevalent chronic conditions on the planet. More common than diabetes, more common than heart failure, yet it remains one of the least discussed, least screened for, and least understood conditions in mainstream preventive medicine. Most people who have early kidney disease do not know they have it. And most people who are actively developing it have been given no signal, no reason, and no language to suspect anything at all. Today I want to talk about one specific warning sign that the research consistently identifies as an early signal of kidney stress. A signal that most people either miss entirely or explain away as something else. Understanding this sign, what causes it, and what it means for your biology could give you years of warning before any conventional test would flag a problem. That is not a small thing. That is the difference between prevention and damage control. If this kind of evidence-based content is useful to you, please subscribe and give this video a like. It genuinely helps this channel reach more people who need this information. Now let us start with what your kidneys actually do, because most people have a much simpler picture of this than the biology warrants. Your kidneys are two fist-sized organs sitting just below your rib cage at the back of your body, one on each side of your spine. Most people know they filter blood and produce urine, but that description barely scratches the surface of what they actually do. Your kidneys filter approximately 200 liters of blood every single day, processing your entire blood volume more than 30 times in 24 hours. They regulate blood pressure through a sophisticated hormonal system called the renin-angiotensin-aldosterone axis. They control the balance of sodium, potassium, calcium, and phosphate in your blood, minerals that regulate everything from nerve signaling to muscle contraction to heart rhythm. They produce a hormone called erythropoietin that tells your bone marrow to produce red blood cells. They activate vitamin D into its usable form. They control your acid-base balance, keeping your blood at the precise pH level that allows your enzymes to function efficiently. They even regulate the amount of fluid circulating in your entire vascular system. When your kidneys begin to decline, every one of these functions is affected, and because they are all so fundamental, the effects show up in systems that seem entirely unrelated to the kidneys themselves. Which is exactly why kidney disease is so consistently missed in its early stages. The symptoms do not point at the kidneys, they point everywhere else. A 2018 study in the Journal of the American Society of Nephrology found that over 90% of people with early-stage chronic kidney disease, stage 1 and stage 2, where function has declined but is still largely intact, were completely unaware they had it. 90%, not because the disease was invisible, but because they were looking in the wrong places and because nobody had told them what to look for. So what is the warning sign most people miss? It is persistent fatigue that does not resolve with sleep or rest, not ordinary tiredness. Not the fatigue that comes from a demanding week or a run of poor nights. A specific, qualitatively different kind of exhaustion. A heaviness, a flatness of energy, a sense that your body is working harder than it should to do ordinary things. The kind of fatigue where sleep does not restore you, where rest does not refresh you, and where it has been going on long enough that you have started to think of it as your new normal. Now, fatigue has many causes. I want to be precise about this because I am not suggesting that tiredness means kidney disease. What I am saying is this: when kidney function begins to decline, the fatigue it produces has specific features. It tends to be accompanied by reduced mental clarity. It is often worse in the afternoons. It does not respond to more sleep, and it frequently appears alongside one or more of the other early kidney signs we are about to discuss. Understanding the full pattern is what makes this clinically meaningful. The mechanism behind kidney-related fatigue operates through two primary pathways. The first is anemia. As kidney function declines, erythropoietin production falls. Erythropoietin is the hormone that signals your bone marrow to produce red blood cells. Fewer red blood cells means less oxygen delivered to your tissues, and oxygen delivery is the fundamental currency of cellular energy production. Your mitochondria cannot produce energy without oxygen. When delivery falls, energy output falls with it. A 2020 study in the Clinical Journal of the American Society of Nephrology found that even mild reductions in kidney function, within the range most GPs would consider acceptable, were associated with measurable reductions in hemoglobin and clinically significant fatigue in adults over 45. The second pathway is toxin accumulation. When your kidneys are filtering at reduced capacity, metabolic waste products that would normally be cleared begin to accumulate in the blood. This state is called uricemia in its advanced form. But subclinical toxin accumulation below the threshold of diagnosis is present much earlier and is directly associated with fatigue, brain fog, and a generalized sense of unwellness. A 2019 paper in Kidney International found that elevated levels of specific uridemic toxins, compounds that accumulate when renal filtration declines, were measurably present in adults with early-stage kidney disease and were independently associated with fatigue scores, even after controlling for anemia and other variables. Your body does not need to be in kidney failure to be affected by impaired clearance. It needs only to be running at reduced efficiency for long enough. Now here is where it becomes important to understand what is actually driving this decline, because kidney disease does not arise from nowhere. It has causes, and most of those causes are modifiable, meaning they can be reduced or reversed if you identify them early enough. The most significant driver of early kidney decline is chronically elevated blood pressure. Hypertension, even at levels most people would consider borderline or mildly elevated, is the leading cause of kidney damage worldwide. The kidneys contain an extraordinary network of tiny blood vessels called glomeruli, and these vessels are under constant pressure every time your heart beats. When blood pressure is elevated chronically, that pressure gradually damages the glomerular walls. They scar, they thicken, they lose filtration capacity. A 2021 study in The Lancet found that blood pressure above 130/80 millions, classified by current guidelines as stage 1 hypertension, was associated with a significantly accelerated rate of kidney function decline over 10 years, compared to adults with optimal blood pressure. The clinical threshold for treatment and the threshold for damage are not the same number, and that gap is where silent damage builds. The second major driver is insulin resistance and high blood glucose. Diabetes is the most common single cause of kidney failure globally, but diabetic kidney disease does not begin at the point of diabetes diagnosis. It begins years earlier, during the period of subclinical insulin resistance and elevated post-meal blood glucose that precedes any formal diagnosis. High blood glucose damages the same glomerular vessels that high blood pressure attacks, through a process of glycation where glucose molecules attach to proteins in the vessel walls and impair their structure and function. A 2022 study in Diabetes Care found that adults with HbA1c values in the upper normal range, below the diabetes threshold, already showed early markers of glomerular damage and reduced filtration capacity. The kidney does not wait for a diagnosis. It responds to glucose load continuously over time. The third driver is something far less discussed: chronic dehydration. Not the acute dehydration of a hot day without enough water, chronic mild dehydration, the state of consistently drinking less fluid than your kidneys need to clear waste products efficiently. When blood is consistently more concentrated than it should be, the kidneys must work harder to filter it, and the tubules, the structures that process and concentrate urine, are exposed to higher levels of solute than they are designed to handle for extended periods. A 2020 paper in the American Journal of Kidney Diseases found that adults who reported consistently low fluid intake had measurably faster rates of kidney function decline over 7 years compared to well-hydrated controls. The optimal fluid intake for kidney protection in adults sits at approximately 2 to 2.5 liters of water daily, not including other beverages. Most adults are not reaching this consistently. There is a fourth driver that I think gets far too little attention, and it is one that I want to address directly because it is so prevalent. Routine use of over-the-counter anti-inflammatory medications, ibuprofen, naproxen, and other NSAIDs. These medications are extraordinarily common. Millions of people take them regularly for headaches, muscle pain, joint discomfort, and general pain management. They are available without a prescription. They work quickly and effectively for pain, and they are marketed as safe for everyday use. And they are safe for occasional short-term use. That is not in question. But regular use, more than a few times per week over months or years, is directly nephrotoxic. NSAIDs reduce blood flow to the kidneys by inhibiting prostaglandins, hormone-like compounds that help regulate renal circulation and maintain the pressure needed for filtration. When prostaglandin production is chronically suppressed, filtration pressure drops, the kidneys compensate by activating stress hormones, and over time, the tissue suffers. A 2021 review in the British Medical Journal found that regular NSAID use was independently associated with a significantly elevated risk of acute kidney injury and accelerated chronic kidney disease progression. If you are taking ibuprofen or similar medications regularly for pain management, your kidneys are paying a price that is not visible on any standard blood test until the damage is already substantial. This is not about occasional use. It is about the habit of reaching for these medications as a first-line response to everyday pain. A habit that is worth examining honestly. So what do the early warning signs actually look like, beyond the fatigue we discussed? The second sign is changes in urination patterns, going more frequently at night. A condition called nocturia is one of the most consistent early signals of declining kidney function. Healthy kidneys concentrate urine efficiently during the night, allowing you to sleep without interruption. When filtration capacity declines, this concentrating ability is impaired, and the body compensates by producing more dilute urine more frequently. If you are waking more than once a night to urinate, and this is a new or worsening pattern, it warrants investigation. The third sign is foamy or bubbly urine. Persistent foam in the toilet bowl, not just occasional bubbles that disappear quickly, but foam that lingers, is a visual indicator of protein in the urine. Healthy kidneys do not allow protein to pass through their filters into the urine. When the glomerular filter is damaged, protein leaks through. This condition, proteinuria, is one of the most sensitive early markers of kidney disease, and it is detectable with a simple urine dipstick test that can be performed in any GP surgery or purchased over the counter. A 2019 study in the Journal of the American Medical Association found that persistent proteinuria was present an average of 7 years before kidney function had declined enough to show up on standard blood creatinine tests. 7 years of warning that most people are not receiving. The fourth sign is swelling, specifically in the ankles, feet, and lower legs, and occasionally around the eyes in the morning. When kidney filtration declines, the balance of sodium and fluid in the body shifts. Sodium retention increases, fluid follows sodium into the tissues. The result is edema, visible, palpable swelling that tends to be worse at the end of the day in the lower limbs and present in the face upon waking. This is not the mild ankle swelling that comes from standing all day. It is persistent, recurring, and present without an obvious mechanical explanation. The fifth sign is elevated blood pressure that is new, worsening, or difficult to control because the kidneys regulate blood pressure through the renin-angiotensin system. Declining kidney function and rising blood pressure create a damaging cycle, each one accelerating the other. New or resistant hypertension in an adult with no previous history is a reason to assess kidney function, not just to treat the blood pressure in isolation. So what do you do with this information practically? The first action is to request a urine albumin to creatinine ratio test at your next blood test appointment. This is a urine test, not a blood test, and it measures the amount of albumin protein in your urine relative to creatinine. It is the most sensitive early marker of glomerular damage available in primary care. It detects kidney stress years before a standard eGFR blood test would show any change. It is inexpensive, non-invasive, and widely available. Ask for it by name. Most routine health checks do not include it unless you ask. The second action is to know your blood pressure numbers and work to optimize them toward truly protective levels, not just below the clinical treatment threshold, but actively toward the range the research identifies as protective for kidney tissue. The evidence points to below 120/80 as the range associated with the slowest rate of kidney function decline over time. If your blood pressure is consistently above 130/80, that is a conversation worth having with your doctor, and a lifestyle intervention worth beginning now, not waiting for a formal treatment threshold to be reached. Reducing sodium intake, increasing potassium through vegetables and whole foods, managing stress, and improving sleep quality all have measurable blood pressure benefits that are directly protective of your kidneys. The third action is to drink more water consistently. Not dramatically more, not obsessively more. Enough to keep your urine a pale straw color throughout the day. That color is a reliable proxy for adequate hydration. Dark yellow urine is a consistent sign your kidneys are working harder than they need to. 2 to 2.5 liters of water daily is the research-supported target for kidney health. Most adults. The fourth action is to treat your blood glucose with the same seriousness you give to blood pressure. HbA1c in the optimal range. Below 38 millimoles per mole actively protects your glomerular vessels from the glycation damage we discussed. Every point of elevated blood glucose sustained over time is a point of additional cumulative stress on your kidneys. Filtration units. The dietary and lifestyle strategies that improve insulin sensitivity and reduce post-meal glucose spikes protect your kidneys directly, reducing sugar load, walking after meals, prioritizing sleep, and managing chronic stress are not just metabolic interventions, they are nephroprotective ones. Your kidneys and your metabolic health are not separate conversations, they are the same conversation. Here is what I want to leave you with. The kidneys are the organs most people pay the least attention to until they fail. And by the time they fail, the window for meaningful reversal has largely closed. That is the particular tragedy of kidney disease. Not that it is inevitable, not that it is untreatable, but that it is so consistently caught too late by a medical system that does not screen for it early enough and a public that is not being told clearly enough what to look for in the years before it becomes a crisis. A 2021 paper in the Clinical Kidney Journal found that adults who identified early kidney warning signs and intervened with blood pressure control, glucose management, consistent hydration, and targeted dietary modification showed significantly slower rates of kidney function decline over 5 years, and a meaningful proportion showed measurable improvement in filtration capacity. The biology is responsive. The intervention window is real and it is long, but it requires awareness before anything else. Your kidneys are communicating with you right now. The persistent fatigue that sleep does not fix, the nighttime bathroom trips that have become more frequent, the foam in the toilet bowl that lingers a little too long, the ankle swelling at the end of the day. These are not random or disconnected symptoms. They are a filtering system trying to tell you something about the load it is carrying and the capacity it has left. And the earlier you learn to read those signals, the more time you have to respond before the conversation becomes a crisis rather than a course correction. If this gave you something important to look for, or a question you're going to ask your doctor at your next appointment, please give this video a like and subscribe so you do not miss what is coming next on this channel. I will see you in the next one.